And we're joined once again by Dr. Shayesteh, who's here to talk with us today about irritable bowel syndrome, sometimes known as IBS. So, doctor, what is exactly irritable bowel syndrome?
Then IBS is functional disorder of our gastrointestinal tract. When our intestine doesn't function properly, we experience some of the common symptoms are abdominal pain, bloating, diarrhea, and constipation, or both of them. And these symptoms can be very severe and can really severely affect the quality of their life.
How can you determine whether or not you just have some of those symptoms, whether or not you have just a symptom or you actually have IBS?
IBS actually most common cause is anxiety and also some nutrition and physical health. There's multiple factors involved. We don't know exact cause of it, but people with anxiety disorders, depression, those definitely experience IBS, and definitely by changing nutrition, also you can deal with those symptoms. That we call it actually then is trigger foods.
Okay.
And those people, these trigger foods are food that they should be paying close attention. Number one is that people with IBS, they should avoid the food that is high in lactose, that's milk sugar, such as in milk, ice cream. That will aggravate symptom, diarrhea, bloating. Instead, they can use lactose-free products or soy milk or almond milk. Another elements in diet that aggravate their symptom is fried foods. They should be avoiding. And definitely artificial sweetener. This is very important, such as sorbitol. This is loaded with basically sugar-free candies and cookies, and definitely that aggravates the symptom. They should be limiting that. Now research shows that consuming just too much sugar itself aggravates the symptom of especially diarrhea in these patients. And unfortunately, other elements such as coffee and caffeine basically, and even chocolate then can aggravate the symptom of these patients.
Okay, we know what we need to probably avoid, especially if you have some of those symptoms. Are there other foods maybe that can help that you could eat instead that could help you if you're coming down?
Yes, Dan, actually very important that the symptom of a patient are all different.
Yes.
Although we call IBS, but everybody's symptom is individualized. That's why the nutrition, everything has to be individualized. Some of the things they should be also watching, I want to mention that is actually watching the alcohol, because that also aggravates them. They should not be eliminating, but they should be limiting that. Definitely dealing with the anxiety. Stress is a major contributing factor for this, and calming down and basically getting a relaxed life and stop basically stressing and micromanaging their life. This is really important.
Yes.
And such as exercise, yoga is very effective to calm down the system. And another thing is very important that then because of the gastrointestinal dysfunction, taking probiotics, even eating yogurt that has a live culture will help to calm down some of their symptoms. One of the most important then with regard to nutrition is keeping the IBS food journal. They should be this is really critical because everybody's symptom different, so designing diet should be based on an individual basis. They should consume the food, write it down how they feel, what are the symptoms they have, so based on that their individual trigger food can be eliminated. So by changing nutrition and their lifestyle and incorporating some relaxation techniques and exercise, they can actually overcome these symptoms and significantly improve the quality of their life, because it can be very annoying when you have IBS and especially in the severe form of it.
Sure, some of those tips are probably good for a wide variety of ailments and that type of stuff as well.
Absolutely. Actually, IBS is very common. 1 in 7 people experience IBS, so everybody would benefit from relaxing and paying a little tiny attention to nutrition there.
All right. Now, if anybody wants to get with Dr. Shayesteh here and learn more about their nutrition and their diet, how can they go about doing that?
They can call the office at 330-729-9665, or they can actually get this segment, also listen to that on their website, WKBN website.
All right. Thank you so much, Dr. Shayesteh, for joining us this evening. We'll be right back with more First News on Fox after this.